Month, calls are growing for menstrual health to be placed firmly on the public health agenda. And this comes amid renewed concerns about the safety of menstrual products following the University of the Free State study investigating potentially harmful substances, including endocrine-disrupting chemicals in these products. We speak now to Dr. Vivian Mokome, who's the founder of Dignity Organic Sanitaries, about menstrual health, product safety, and regulation, and why women need a stronger voice in decisions that affect their bodies. Thank you so much indeed for joining us, and a very warm welcome to the program.
Thank you so much, and good morning.
Tell us about this. I guess the research that came out of the Free State study and the concerns that have come out of that. For many people, I'm sure, would have had no idea that some of the ordinary products that are being used are potentially harmful to women, and that this has probably been going on for years.
Yes, it's true. It has been going on for years. There's nothing new with the report that was released by Prof. And if you recall very well, he said he's been doing this research for almost 3 years. So there was nothing new. The same study was released by one of the universities in Kenya, and that was done in it was in 2021 and 2022 when some women in Kenya they decided to boycott the same sanitary pads that were listed by Prof. So yeah, there is nothing new. It's something that most of us have known. I've known about this since 2018. That's why most developed countries they're not using most of these products that we are using. So it's something that has been going on for quite some time.
Explain to us in lay people's terms exactly what these products can do and in terms of harm.
Okay, I'm gonna try and simplify it, because we tend to use these complicated terms, and at the end of the day, that's what confuses our people. That's why you see them still going back to what they know or used to. The vulva or the lining of your vagina or your vulva as a woman, it is highly absorptive, highly permeable, which means it can easily absorb any chemical found on your underwear or a sanitary pads and transport that into your bloodstream. I don't know if you understand this. Let me repeat it
Yes, we
again.
understand, yeah.
The lining of your vulva as a woman or vagina, it is highly permeable. So as soon as it gets in contact with any chemical, it can be from your underwear or your sanitary pads, it easily transport that into your bloodstream. All right. Now, some of these chemicals that are found in these sanitary pads, they disrupt what we call our endocrine glands. So it disrupts that. That's why it can easily affect your hormones, growth. So there's a lot of things that it can easily affect as far as your endocrine gland is concerned, you know. And it can also lead to cancer,
Right.
and the same thing has also
So
been confirmed.
I'm shocked also to hear that this study found that these hormone disrupting chemicals are even in pads that are marketed as organic or chemical free. As someone who sells an organic pad, how do you explain this gap between the marketing claims and what the lab found? How are some of these pads getting through the system?
You'll be shocked. Sanitary pads are not tested in South Africa. A sanitary pads in South Africa is not treated as a health product, and which is wrong. You know, even organizations that we trust, such as your SAPRA, which is a South African health product regulator, they do not physically test as sanitary pads, you know, and there are no policies in our country that are forcing the manufacturer of these sanitary pads to be open or transparent in terms of the chemicals that are found in their sanitary pads. So that's why it's easily for anybody to say um, it's organic, or for someone to say the chemical is there, but it is at the acceptable amount. You understand? Because
Yeah.
um, no one is held accountable. And the sad part is that I guess you know what you know. Women are not at the forefront of producing sanitary pads or influencing policies as far as sanitary pads is concerned. I mean, we had the Minister of Health, who is a man, who came and debunked the study by the professor. Do you understand that? I mean, the man who is not using a sanitary pad, who came and debunked the research, the study, by saying what I liked is that he did acknowledge that the chemicals are there. He did acknowledge, but he said it is at the acceptable amount, you know. But it's unfortunate that there were no women, or they were there, but those women who were there, they failed to ask him critical questions to say what is the acceptable amount. Because as far as I know, a woman will use plus minus 6,000 sanitary pads throughout their entire menstrual cycle, plus minus 6,000, depending
So
on your mood and
I'm
when you
wondering
start.
now, there must be many, many female doctors in clinics who are receiving women who have suffered as a result of using these kinds of chemically stained sanitary products. Why isn't there enough of a voice being either voiced or heard about this issue?
You know, that's a good question. I actually never even thought about it. You know, and the more you're saying it, I actually even get upset about it. You know, why are women quiet? I mean, hello?
Yes, we can hear you. Yeah, yeah.
Oh, sorry. Why are women quiet? I mean, lived experience should be more than even scientists. Do you understand? Women, they know the pain. They've lived through the pain. You know, they know the suffering. I guess it's because of our historical background, where we come from as a nation. Such topic, it used to be a taboo. Women in our country are not prioritized. Anything that affects women and children is not prioritized. And we come from a generation where this topic was not a topic that we could easily talk about it, you know, or I mean, over a dinner table. So maybe that's the reason. Unfortunately, in this case, I'll have to excuse them because it doesn't make sense why women are quiet about it. I guess you know what you know. It's think about it as well for a sec. If we remove these pets from the shelf, what will we replace them with? I think that's where the challenge is. Because in health, if you remove something from the shelf, they need to be a substitution. So if we were to remove this product, what are we going to substitute them with? And already in a country, we have an issue of period poverty, where 30% of young girls are not going to school because they don't have pads. Now we're talking about just pads, not even good quality pads. So I think that's where the challenge is. So people, they choose to keep quiet about it.
I think you've said it already today, and I guess, and you've said it before as well, that I guess it's who's in the room when
Yeah,
these
who
products
is
are
there?
being designed is
Mm.
probably where this issue starts and becomes problematic.
Yes, maybe the person who's
And
there
you've
might
also
not even
mentioned
know, might not
testing.
even
So a
care.
lot of things need to change, it
Mm.
seems, particularly if we're going to get this right in the long term.
It's exactly. And I like it. Who is in the room? That person might not even know or might not even care. But let me say, let me not say they might not care. They might not know, you know. But it's channels like this one that will amplify the voice, you know, because the whole of this month I've been attending different interviews, So I'm hoping and I'm looking forward to a day where our country, women in position of influence, you know, they'll understand that we don't just need pads, but we need good quality, organic, biodegradable sanitary pads. You know,
From
people
your
will start
understanding
asking.
and maybe some research, is this a problem across the continent? Are other African countries
It
facing the
is.
same issues that South Africa is going through?
It is. South Africa, it's even much better. Let me be honest with you. A lot of work has been done in our country. It has been done. We're not yet where we want to be, but a lot of work and a lot of women have been advocating for this. In other parts of this beautiful continent, it's worse. It's worse. Women are suffering in silence. Like I said, you need to understand our historical background. This is not an easy topic. This topic has been associated with shame. It's a taboo, you know. We still have churches where, when it is the time of the month, women are not even allowed to go to church. You understand? There's so much stigma around this. So South Africa, we are trying. We've done well. You know, we've came a long way as a country, because now we are no longer talking about just pads in South Africa, but we are looking at the quality of the sanitary pads. Now, in these other countries, it's still an issue of pads. I don't know if you understand. So
Yes,
now in South
yes.
Africa, now we're looking at the
It sounds
quality.
to me, and again, listening to the story, that healthcare is a basic human right, and
It is.
for products to be allowed to be sold to women that can harm them is an
Mm,
abuse of human rights. And when we talk about menstrual justice, hey, this is a very real justice issue, and maybe even
it is.
something that needs to be visited by the Constitutional Court.
We have to do that. It has to. It's a human right. We cannot be giving our women products that we know that are harmful. And I think the part that they've missed is the one that I've started with on my introduction. Once we understand that the lining of your vulva or your vagina is highly permeable, whether there shouldn't be any chemical in a sanitary pad, considering what I've just mentioned with the lining of your vulva. So I think that's the most key point that they've missed. That's why the minister could easily say the chemical is there, but at an acceptable amount. But if your lining is highly permeable, there shouldn't be any chemical at all.
So, if I
I
made
guess our
you
women
health
are not
minister,
knowledgeable.
what would be the first things that you would do to try and fix this problem?
Pets, first of all, I would make sure that pets are treated as a healthcare product. Meaning, if it's a healthcare product, SAPRA should ensure that all sanitary pads are tested. And if a sanitary pad is not tested, it should not be on the shelf. So that's the first thing that I'll do. That a sanitary pads is a healthcare product. And if it's a healthcare product, it should be treated as such. Pads should be tested.
Have you ever engaged the producers of some of these problematic sanitary products? And if so, what did they say?
I didn't approach the producers. I'm a producer as well of the sanitary pads, but I did approach SAPRA, because my company, we have a license to produce sanitary pads by SAPRA. But I did challenge them that they need to start testing
What did
the
they say?
actual sanitary pads. They are currently working on it. Actually, I need to follow up, because when I spoke to them, it was last year. I did challenge them that you need to start testing sanitary pads. It's not enough looking at the test results from the manufacturer that we are giving to you. You need to do the actual testing yourself. And I've went as far as approaching universities myself as the producer. I'm working currently with the University of Johannesburg. I've given them my sanitary pads to test.
Okay. Dr. Mokome, we're going to have to leave it there, but thank you so much indeed for educating us. And I think some of these things slip through the system and people just don't know what they don't know. But thank you so
Yeah,
much
so
indeed
true.
for your time.
All right. Thank you. Thank you for having me here.
That was Dr. Vivian Mokome, who's the founder of Dignity Organic Sanitaries. And I just think our authorities really, really need to pay attention to this, because if one woman is dying as a result of harmful products in sanitary wear, then it needs to be dealt with.
The sound of Africa, starting strong. Rise and shine with Peter Ndoro and Sepiso Makwetla on the Channel Africa app and SABC Plus.
7 o'clock is your time, which means it's time for the second hour of Channel Africa's Rise and Shine with Sepiso Makwetla and Peter Ndoro. And we begin this hour with your news and sports headlines with Jwalani Tulong.